I get a call from an attorney saying, we have a case of alleged strangulation and there's no physical signs and symptoms on the neck, there's no bruises on the neck, there's no nothing. I am on my way to testify in court, and I wanted to take a minute to talk to you a little bit about strangulation and why you need an expert in your case. In many of the strangulation cases that I review, one of the first questions that comes up is whether or not petechial hemorrhaging is indicative of a strangulation assault. And a common misconception is that you have to have petechial hemorrhaging for there to have been a strangulation, or the similar subconjunctival hemorrhages is another similar injury that is related to strangulation assaults, or commonly associated with strangulation assaults. So first, let's talk about the petechial hemorrhaging. The way strangulation occurs is there are three different methods. One, you can either obstruct the airway right here, or you can obstruct one of the two vessels that runs here in your neck. When you take your pulse, you're actually taking your pulse on your carotid artery, and that's one of them, one of the vessels. And then slightly superficial, slightly more closer to the skin, is your jugular vein. And the carotid artery takes blood up to your brain, from your heart to your brain, and provides all the oxygen and nutrients that your brain needs. And then your jugular vein takes that same blood away from your brain and takes it back to the lungs and the heart to be recycled back through the body. So what occurs to cause petechial hemorrhaging is you obstruct the jugular vein, but not the carotid artery. So if you imagine a balloon blowing up, the blood is going into the brain because the carotid artery is still open, but it is not leaving the brain because the jugular vein has been obstructed. Now, if you can imagine, we have these vessels on both sides, so you actually have to obstruct both sides for petechial hemorrhaging to occur. And when that pressure increases, so the blood keeps going in, you're blowing up the balloon, and the pressure increases until the point that the tiny little blood vessels that are either, you have them all on your face, in your eyelids, and the soft tissues underneath your eyelids. You can see them if you pull your lip down. So that's the most common areas that you'll see petechial hemorrhaging is like underneath the eyelids, in the lips, or possibly in your cheeks. And there's little teeny blood vessels in that area that burst due to the increased pressure of all that blood going up into your head and into your brain and not leaving. So how does that happen? Like I said, you have to obstruct the jugular vein, but not the carotid artery. And that doesn't necessarily happen in every strangulation assault. If just the airway is occluded, or if both the carotid artery and the jugular vein are occluded, or if only one side the carotid artery and the jugular vein, or I should say if only one side is occluded of the jugular vein, but not the carotid artery, none of those instances will result in petechial hemorrhaging. Also, the amount of time it takes for a petechial hemorrhage to occur is usually about 20 to 30 seconds. So if it's a shorter time frame, or in many strangulation assaults, you'll hear the victim say that they squeezed and then they let go, and then they squeezed and they let go. Well, in the process of letting go, you're allowing the blood to leave the brain again, and the pressure reduces. And so it would take longer for petechial hemorrhages to occur if there was a squeezing and letting go type mechanism. I do work for both the prosecution and the defense, and it doesn't matter who I'm working for, the facts are always the same. The way I look at strangulation cases is not about the physical signs and symptoms, because there are not the physical signs, I should say. There's literature to say that there are oftentimes no external signs of trauma in strangulation victims. And so what I look at are the signs and symptoms of hypoxia, and whether or not the complaints of the victim support her allegation of strangulation. So if a victim complains of inability to breathe,
vision changes, headache, loss of consciousness, incontinence of bowel or bladder. Those are all concerning for strangulation. They are supportive of strangulation.
And then the other one I mentioned was a subconjunctival hemorrhage. Now that's the type of hemorrhage that you see actually in the whites of your eye. And a lot of people get these spontaneously. You may wake up in the morning with a burst blood vessel in your eye. Some people get them when they're sick and they're sneezing too hard, coughing too hard. You can also even get it from rubbing your eye too hard. So there's a lot of causes for a subconjunctival hemorrhage, but also you can see it in the same mechanism by which the petechial hemorrhaging occurs, where the pressure increases in the head and the brain, causing the blood vessels in your eye to have the pressure increase, and they are very, very fragile, and so they burst. But as I'm sure you can follow, subconjunctival hemorrhages definitely are not specific to strangulation, and actually petechial hemorrhages aren't either. There are many other causes to petechial hemorrhages, including certain viruses, medications. You can actually see them from bearing down too hard, so you might see it in weightlifters or in pregnant women when they are they're in the process of labor. So the bottom line is that the absence or presence of petechial hemorrhages does not conclusively determine whether or not a strangulation assault occurred, and the same thing is true of a subconjunctival hemorrhage. So I hope this information has been helpful to you, and please contact me if you have any questions.